That makes sense. That makes sense. So I'm going to have the audience ask a few questions here. So Charles H., if you could please state where you're from and ask your question.
Yes, I'm from Orange, Texas. My question is, as far as like heart attacks and strokes and such, not having as much issues in the past, but we ate meat and fish and eggs and such. Is it because of different toxic feed and the way they're treated and vaccines that they're given now for the animal protein?
Yeah, animal protein seems to injure endothelial cells. Right.
So I think the specific question, though, was more looking at, is it the animal protein itself, or is it all of the stuff that we're doing to the animals?
Oh, yeah, I think a good way to answer that would be the following. George Mann was a physician who had a strong belief that if you ate beef that was clear, so we say, that was something like you'd see with the Maasai. So he funded a study where people went to Africa, and here are the Maasai, who are these herdsmen living in this really pristine ground. They're not using any, vaccines or potions or antibiotics for their stock. And they thrive on milk, blood, and meat. And he autopsied 50 of the Maasai, absolutely loaded with heart disease.
So even if the animals are pristine, it's the animal itself, the animal product itself, not all the stuff that we're doing to it.
Well, I can't tell you that what we're doing to them doesn't accelerate it.
Right. So that may even make it worse, right? Sort of like with mercury with fish, right? So the fish itself, not good for your health, my understanding is, but the mercury makes it that much worse.
Well, fish they all grow up in a dirty swamp, and the ocean is just so toxic.
So what recent research has been done that validates your work and gives you hope that your body of work and the idea of a whole food plant-based diet and lifestyle is becoming more popular or more accepted?
Well, there are physicians who, when they understand this, are willing to make a commitment to make it try to happen in their practice. And the one that absolutely jumps out at me is my good friend from Montefiore Hospital in New York City by the name of Robert Ostfeld. Robert Ostfeld has literally taken the whole idea of whole food plant-based nutrition, and as far as I'm concerned, he's taken New York City by storm for this. And it's really, he's so committed and is making it happen, so that when you see this happen, you just know that the people who train with him are going to be so empowered by that. And anybody who's a physician who suddenly sees these exciting results said, well, geez, if they can do it in New York City, you can. I mean, I found out years ago we could even do this east of the Hudson River in a place called Boston.
Nice. So, all right. So the next question is going to come from Joe W. Please state where you're from and ask your question.
From California, Dr. Esselstyn. Since cooking damages or destroys the minerals, vitamins, and fiber in food, do you think that raw food is more whole and healthier than cooked whole food plant-based?
That's a good question, but I would not fear at all cooked food. I think there's still so much in the way of vitamins and phytonutrients that really you're unlikely to be deficient. I would like patients to take B12 and be sure about perhaps their vitamin D. Yeah.
And can you speak a little bit more about vitamin D? It's quite a contentious issue. Our next speaker, Dr. Pam Popper, is not a fan of vitamin D. We had one doctor who gave a whole lecture on the importance of vitamin D. What's your thoughts on why is vitamin D important, and what, if you believe we should supplement, why should we be supplementing with it?
Well, I'll never get into a wrestling match with Pam. she'll pin me in a moment. But
She's
yeah, I think that I'm going to let it stand that the presentation you had of somebody who was pushing vitamin D will be the one who I think answered your question more precisely than I would.
okay. All right. So I'll leave that to her. So the next question is going to be from Connie S. Please state where you're from and ask your question.
Hi, South Royalton, Vermont. And I was just wondering if you could repeat the instructions for eating steamed greens like 6 times a day and putting a little vinegar on them to increase the production of nitric oxide.
Right, exactly. What part would you like? Well, I'll just.
Was it a third of a cup of steamed greens that you start chewing them and then you have a little vinegar with them, or what?
Here we go. I need the patient to chew 6 times a day a green leafy vegetable that is approximately 1/3 of a cup after it has first been steamed or boiled 5.5 to 6 minutes so it's nice and tender. And then you must anoint it with several drops of a delightful either balsamic or rice vinegar. Why? Because research has shown us that the acetic acid from those vinegars can restore the nitric oxide synthase enzyme contained within the endothelial cell and responsible for making nitric oxide. Is that what you wanted?
Thank you very much.
You're welcome.
Great. Thank you. Our next question is coming from Cheryl L. Please state where you're from and ask your question.
I'm from California. Hello, Dr. Esselstyn. Thanks so much for all you do. I so deeply admire you. Your son, Rip, mentioned in an interview with Chef AJ that you once fasted 18 days at True North Health Center. So my question is, do you recommend water-only fasting to reverse or prevent disease, not in place of a healthy diet, but on top of the diet that you recommend?
All of our patients so far have been treated as I've mentioned today. No, fasting has not been an integral part of the program. I'm not against it if people on their own want to do this, but I don't think people can do this on their own. I think with Alan Golden,
Yeah. Sorry
we
about
got
that.
a lot of conflict here. I can't. Hello?
You're good. Sorry about that.
So I think that the business of fasting is something that is being rather thoroughly investigated. And I think we always have to keep our ear to the ground and respect that there's no question that there are some profound benefits that can occur from fasting, but it has not been an integral part of the program that we have so far. And when you think about it, we all had our groundwork and excitement in beginning all this from observing what is happening throughout the culture. Throughout the cultures on this planet, where cardiovascular disease has been virtually non-existent. But I'd keep your ear to the ground on fasting. I think there's so much more we are to have to learn about this, and we have to applaud people like Alan Goldhammer who have set the high mark for this.
So now I had once spoken to Dr. Goldhammer and Dr. Give me 1 second. Okay, so I once had spoken to Dr. Goldhammer, and he actually said that, I was talking to him about fasting, and he said that better than like doing a 1-day fast or 2 or 3 day fast is time restrictive eating. Does that matter? And if you don't have any comments on that, that's fine. We can move to the next question.
I don't.
I'm sorry?
No, I don't.
No? Okay, great. So you'd mentioned about when you're able to reverse cardiovascular disease, it tends to be with newer plaque and potentially younger patients. But then you said that older patients though can go back to their old lifestyle, with a healthy lifestyle, can go back to doing physical things and being energetic once they go on a lifestyle like that, make these changes, go on a lifestyle like this. what happens? Is there calcification that takes the plaque in the arteries and makes it less likely to rupture? What exactly?
I think, oh, that's absolutely true. You know, I can remember, it must have been, gosh, about 18 years ago now, when I first learned about calcium score from a fellow by the name of William Castelli. And Bill Castelli was for 30 years the director of the world famous Framingham Heart Study outside of Boston. And Castelli told me, he said, when a physician orders a calcium score, it gives you two pieces of information. One, it tells you the patient does have coronary artery disease because there it is, a calcified plaque. But he says it also tells you, but it cannot show you, that that patient also has non-calcified inflamed plaque, which are the more dangerous ones, which can rupture and cause a heart attack. But he said, let's do this. Let's take the example of a patient who has a calcium score of 440. All right. And now they absolutely get it right. And for the next year, they're totally committed to whole food plant-based nutrition, which is so anti-inflammatory. So those previously non-calcified plaque during this year are having all their inflammation lost. And he said it is as though the body wants to get in on the act that it will deposit some calcium in those previously non-calcified inflamed plaque as they're losing their inflammation. And that, of course, goes to protect them, because then they cannot rupture or cause a heart attack.
Wow, that's great to hear. So just a heads up to the audience. We just had a technical glitch earlier, and we may, in about a minute and 20 seconds, we may have a little technical glitch, but it'll just be a little hiccup. So just a heads up on that. So you mentioned studies, and I've heard pushback with these dietary studies on randomized double-blind studies are the best. Why is it hard to do when you're working with diet?
Well, I think a couple of things to answer that. I think we have now proved beyond a shadow of a doubt that heart disease can be halted and can be reversed by all these measurements that I've tried to share with you today. So that is a fact. Now, when you bring up the idea of making it randomized, I don't think that there's any internal review board on the planet that would accept that kind of a study. How would you take somebody with heart disease and say, look, and you have to tell them this beforehand, we're going to have a study. You will be randomized. We don't know whether either to a treatment that'll stop your disease.
Recording in progress.
Okay. Well. All right. So sorry about that. We just had that technical glitch I was talking about. So I think we're past it now. So sorry.
Recording in progress.
I'm sorry, Dr. Esselstyn?
No, what I was trying to respond to your last question. That's why I don't think that a randomized study really can be done in that situation.
Okay. And double blind, I think for obvious reasons, but I'll let you speak on that. Why can't that be done?
I mean, what's been done is it's absolutely unequivocally, it's been proven. There's a group in India that's done it. Ornish has done it. Yours truly has done it. And I think there's somebody to say that it can't be done is not correct.
All right. So the next question is going to be coming from the audience. David R., state where you're from and ask your question.
Hi, this is David from Massachusetts. Doctor, you mentioned the possible side effect of statin. What are your thoughts about red yeast rice? Can it mitigate some of the side effect? And also regarding nitric oxide, there are some supplements on the market. What are your thoughts about this? Thank you.
Let me see. What was the first one?
The first one was about red yeast rice. Do you think that
Oh, yeah.
this
Oh,
can,
no, I've not used it. I can't give you any specific information about that. But I think that if there's a question about allergies to statins or problems with red yeast rice, whole food plant-based nutrition, which I've been explaining today, has been shown to be just as effective in our experience as patients who cannot take statins. And the other question you had was the last one?
was about supplements for nitric oxide. What are your thoughts about supplements for nitric oxide?
I think what we have to do is keep our eyes and ears open. We'll see how effective that kind of approach will be in patients who are seriously ill with heart disease. And when we see that, I will remain quite open-minded, but I don't think I've seen that study yet.
Thank you. Thank you. So you mentioned about the bacteria in the mouth and the I guess in the the importance of that and the effect on heart health. Can you talk a little bit more about that? Why does that matter? We actually had a speaker on also, and he mentioned about tongue scraping actually have a positive impact on blood pressure. Why would that be?
I have no idea about positive impact on blood pressure and tongue scraping. That's something I'm not familiar with. Okay.
Well, but you did mention about the bacteria in the mouth. Why is that important?
That's part of the process of your the bacteria in the mouth will help to reduce the nitrate that you've been chewing to a nitrite. That's an essential step, because the next thing that happens is when you swallow the nitrite, it is now your own gastric acid, which is going to further reduce the nitrite to more nitric oxide, which can enter the nitric oxide pool.
Okay. All right, great. And going to throw it out to Shiv Kumar. Please state where you're from and ask your question.
Hello, my name's Shiv Kumar. I'm from the UK. I was just wondering, I was reading about carbohydrates. They said carbohydrates, too much carbohydrates could increase cholesterol levels. And also my doctor, I had a blood test recently. My doctor said that my good cholesterol is slightly low. So how do you think I could improve that? So it's two questions.
I think I've got one about
Shiv, can you ask your question again? Sorry. Shiv.
Too many.
Say it again, please.
Eating too much could.
Sorry, start it over again, Shiv. You somehow got muted. Jeez. Keep on.
Oh, can you hear me?
Yes, but you keep on. Just leave. You're good where you are. I think you keep on muting yourself.
Okay.
So.
Yeah, I was just reading about carbohydrates. They were saying that eating too many carbohydrates could increase the cholesterol levels as well. And another question is, my doctor says, I had a recent blood test. He says my good cholesterol is a bit low, so I don't know how I could compensate, getting that back up to normal.
No. Okay. No, those are good questions. First of all, as far as the carbohydrates causing a cholesterol to go up, if you're staying away from simple carbohydrates, the white bread, white rice, all the sweets and so forth. But if you're eating carbohydrates like bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard green, turnip greens, snap, cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula and asparagus, when you eat those, by the way, the reason I say that way is so the audience knows how powerful whole food plant-based nutrition can be for your memory. Now, but so you're not going to have we see just the opposite. The cholesterol absolutely plummets when patients start eating whole food plant-based nutrition, which is so filled with carbohydrates. Now, as far as the HDL cholesterol, this is worth spending a moment on. Years ago, it was always felt that good HDL cholesterol was important, healthy, and good for you because it's an anti-inflammatory molecule. When we first started our study with these men, within the first month, remember now that the low level of cholesterol for men that is accepted for their HDL is 40. Well, suddenly within literally a month or so, every one of our men now had a cholesterol in their 30s, but at the same time, they were losing weight. They also were losing their symptoms of heart disease. And when we carefully studied them, they were reversing their disease with a lower than normal HDL cholesterol. And it was interesting that when the late Bill Connor went down to the Tarahumara Indians in northern Mexico and studied them, their average HDL cholesterol, remember, they never have heart disease. Their average HDL cholesterol was 25, which would drive the unknowing cardiologist absolutely apoplectic. So really, it's so important that patients should understand that if they are going to be eating whole food plant-based nutrition, which is so anti-inflammatory, the liver, which is responsible for producing your HDL, recognizes that the body has so much less inflammation, they are going to make less and less of this powerful anti-inflammatory molecule of HDL. And so if you are eating whole food plant-based nutrition, one of the signatures that you're doing it correctly and doing it well is that your HDL will reduce.
Great. Thank you. And with that, we have concluded our time. So thank you so much for all the information that you shared with us, Dr. Esselstyn. It's been very enlightening. So if we could unmute the audience.
Doctor, you're awesome.
I'm liking this one out. No, I don't care.
You're wonderful.
I'm sick of this job.